everybody, welcome back to my channel. My name is Vivian. Today we're talking about revalidation with the NMC. So if you're a registered nurse in the UK or a pre-registered nurse or a nurse in the temporary register, you should be aware of this. So revalidation is basically what the NMC expects you to do after 3 years of being in the register. So you're expected to pay your annual retention fee, which you can automate via direct debits, and you're expected to do your revalidation after 3 years. So revalidation is a process every nurse in the UK goes through every 3 years to ensure that they are still going to remain in practice and their license to remain valid. So if you're interested in this and you want to know what this is all about, do stick right to the end of this video. Revalidation can be doubting to a lot of nurses, and this is expected because it's something that you're not totally open to. It's not something that you do every day. It's just something that is expected of you, and it's something you must do to get your PIN instated and to ensure that you're practicing as a registered nurse in the UK. So the NMC has provided guidelines on revalidation and what you need to do to validate. So this should not be an issue, but it's something you just need to follow guidance and follow up to the latter. So let's get right into what the NMC has to say. On the NMC website, there is a PDF downloadable document that you can download for step-by-step guide. Even on Royal College of Nursing's website, you can actually open a portfolio for your revalidation, whereas you can put in documents concerning your revalidation as you do the courses, such that when your revalidation comes closer, all you just need to do is to go ahead and print those portfolio. The first advice I'll give is for you not to wait till you are summoned for revalidation to begin to prepare for your revalidation. As a matter of fact, you should begin your revalidation from the first day of your first year on getting your PIN. You should prepare for your revalidation because it's about document gathering, fact gathering, data gathering, feedback gathering, reflection on your practice. So it's something you should do every day in practice. So for instance, you're at work and you find today very tiring, or you found a case that was very difficult, you could reflect on the outcome of that case, and that could account towards the reflection in your revalidation based on your practice. Before I begin to talk about reflections, I need to talk about what revalidation entails so you can understand what I talk about when I begin to explain these terms. So revalidation is a process that all nurse and midwife in the UK will have to go through to ensure that they remain and maintain their registration. And this started as of April 2016. So it's been 4 years down the line for nurses to validate in the UK. So it should be a process that is well thought out for. However, for overseas nurses who just came into the UK, it can be daunting because you've not done it, you've just gone through your OSCE, and now you're going to be validating. Relax, it's just something you have to do and you will get there. This validation is supposed to help you demonstrate that you practice safely and help you to reflect on your practice. That is to say, during the validation process, you are looking back inwardly on your practice and saying, what have I been doing all those 3 years? What have I been doing right? What have I been doing wrong in relation to the code of the NMC? The code of the NMC is downloadable on the website, and which you should know as a nurse. Now you're going to be reflecting based on your practice if what you've been doing during the past 3 years has been reflective of the code. If you have been doing things right by the code, and if you've been doing things wrong, it helps you to bring things to mind and begin to correct your practice and begin to do the right thing in your practice. Now, for you to revalidate, you have to make a revalidation application online, and you can do this through the NMC online. If you do not have an NMC online account, you can go onto the NMC website and click to register for your NMC online. Now on the NMC online, that is where you're supposed to submit all your documents for revalidation. You'll be put through the process of setting up your PIN and validating your NMC online account. That is the first step to revalidation. Now, usually the NMC sends an automated message to you, I think on the first day before the 30 days towards the day of your validation. For instance, you're supposed to validate on the 30th of April or submit your application for revalidation. NMC would have sent you an email to remind you on the 1st of April that you're expected to validate on the 30th of April. And that's 4 weeks gap for you to prepare. Like I said, you should not wait for this email to come. You should begin to prepare for your validation on the first day of your practice, or if you have not thought of it, begin now to think about your revalidation. Now, the requirement for validation to maintain your practice is 450 hours of working in your field. For instance, you work in the adult nursing or pediatrics, or you're a lecturer, or you're a tutor, or you are a manager. You are expected to have worked 450 practice hours. And if you, as a nurse who has different practice area, for instance, you're a registered nurse and a midwife, and you hold license for both, or a registered nurse and registered mental health nurse and you hold license for both, you're expected to have 450 practice hours as a nurse and 450 practice hours as a midwife, or as a mental health nurse, or as a pediatric nurse. So you are expected to have 900 practice hours in both registration. Okay, so if you're a mental health nurse and a nurse, an adult nursing, you should have 900 practice hours. If you're an adult nurse alone, you should have 450 practice hours. The next thing you should have is 35 CPD, continued professional development hours, out of which 20 hours are participatory learning. And what is participatory learning? That is, you have to be one-on-one with people, face-to-face with a tutor or a teacher and other learners. Now, so 35 hours of continuous professional development, CPD, 20 of which should be participatory learning. Now, this can be in form of a practice, your BLS, ALS, or teachings in your academy, or a training, or something that involves you and somebody else, not just your own personal reading. You can actually get CPD points by studying online, as we all know. However, the NMC is saying 20 of those unit points of those CPD should be participatory learning. Somebody else should be involved in that learning with you. Also, you're expected to have 5 pieces of evidence-based practice feedback. So 5 pieces of practice-related feedbacks. Now, this could be feedback from a manager, feedback from your colleagues, feedback from your patients. Okay, so if you're somebody who works in a hospital, or if you work in the teaching sector in the school, you should get feedback from your lecturer, feedback from your colleagues, feedback from any area of nursing where you practice. Okay, so this is feedback relating to your practice, how you practice, whatever it is they have to say about you. You should get 5 pieces of feedback concerning your practice from people, your manager, your colleagues, your patients, patient relatives. Just get a feedback. That should do. And also, you should have reflective discussions. 5 reflective written counts. So for instance, if you have a CPD, some CPD programs will give you the ability to reflect on the CPD that you have just studied. So for instance, you go on College of Nursing website and you pick up a CPD or an e-learning there. They will have places where they tell you to reflect on what you've learned and write about it in relation to your practice. Now, that could be a reflective discussion. Now, in some other trucks, you could have reflective discussions based on drug errors. You could have reflective discussions based on academic training in your trust. Whatever it is that you're writing a reflection, it's just a reflection on what your practice is, what you understand, you relate this in relation to the NMC code, how it relates to practice, how it relates to dignity of the person, how it relates to promoting all that the NMC code promotes. That's what you have to reflect about in those reflective discussions. Now, you are expected to have 5 of them, and you have reflective discussions. Now, discussions has to be with somebody. Definitely, you have to discuss with somebody. It could be based on practice, it could be based on your CPD, it could be based on your experience, it could be based on anything. It could even be based on your practice towards your promotion, or towards preparing for a promotion, your preparatory hours in researching to go for an interview, your preparation even for your post as a registered nurse, or preparation in caring for a particular patient, or in caring for a patient, or in caring for a particular disease condition that you met during your practice during those first 3 years. So whatever it is you're going to reflect about, just discuss it with somebody and document it. And this reflective discussion has to be done with a fellow NMC registrant. For instance, a registered nurse, a registered midwife, mental health nurse, whatever it is, it has to be somebody who is on the NMC register. And you have to discuss with them based on the feedback, based on the CPD, based on your practice, whatever it is you have written reflective accounts about, you have to discuss it with this NMC registrant. And the person who you discuss this with, you have to sign that they have discussed this with you, and also record it, their email, their NMC pin, and their name. So usually your manager will be the one who should do this for you, or a senior nurse in your hospital. It really doesn't matter if it's not your manager, because people who work in the care home, or who are freelance nurses, who are agency nurses, also do their reflective discussions. So far as you meet up with a registered nurse who has a PIN and discuss with them, and the person is happy that they've seen proof of what you've discussed, and they can sign and put up their PIN for you in your NMC reflective discussion. So whoever signs your reflective discussion with you will have to input their professional email address, for instance, where they work, and also their NMC PIN and the date in which they had these reflective discussions with you. There is a form downloadable on the NMC website, the reflective discussion form, where you will download and be able to write your reflections in for you to upload to the NMC. You should keep this document safe for documentation purposes because you could be requested or be asked to present them in future times. Now, your feedback could come in form of your annual appraisal. It could come from patient, relative. It could come from your colleague. It could come from a manager. It could come from anybody. As far as it's a feedback on your practice and it's practice related, it is okay. Now, depending on wherever you practice, that should be the feedback you're giving. So you shouldn't be worried that you're working in a hospital or in the teaching sector. Whatever feedback you get wherever you are working, as far as it's related to your practice, it is termed as a feedback. And also note how those feedback help you to improve your practice, how does feedback help you to practice better as a nurse in relation to the NMC code. On the NMC website, you'll find completed forms and examples of what these feedback forms look like, so you can use them to document your own feedback also. So basically, those are the things that are expected for you to have for your NMC revalidation. You should have 450 hours of practice hours or 900 practice hours if you have a registration in 2 different cadres in the nursing register. You should have 35 CPD continuous development points, 20 of which should be participatory, and you should also have 5 reflective accounts, 5 reflective discussions that should be documented with an NMC registrant who also will serve as your conformer. A conformer is somebody who is going to say yes, true to the NMC. I have seen these documents provided by this nurse and they have not lied and they have actually done all that is expected, and this person is expected to sign this document for you to submit. Now, this can be done for you by a manager, a senior nurse, or a fellow nurse if you're working in an agency and you don't have any senior person with you. And also, you should have 5 feedbacks. This could be from family, friends, relative, in form of your appraiser, whatever it is. As far as a feedback of your practice, it is going to serve. So you're expected to declare your health and character, that you are healthy and that you are able to practice further in the register without any problem. So you should declare if you have been charged, if you've been convicted, if you've had any crime in recent times. You have to declare everything to the NMC because you have to also reconsider your post in holding the PIN as registered nurse in the UK. So whatever has happened in the last 3 years that have been of interest physically, legally, you should document it in your application for revalidation. And also, if you have been issued any formal warning or caution in your place of work, you'll be asked to declare if you have been subject to any adverse determinations that your fitness to practice is impaired by a professional or regulatory body, including those responsible for regulating the licensing or the licensing of a health and social care profession. So your character is central to the code. The requirement is that you declare that your health and character enables you to practice safely and effectively. You do not need to collect evidence that you prove this, and you just need to just declare it, and you complete the form when making the application. Just like when you apply for your registration as an NMC into the NMC register, you sign the character and health declaration form. The same thing is going to be expected of you when you revalidate. The next thing is that you have to show that you have professional indemnity. Now, you're expected to have professional indemnity that you have been practicing under appropriate cover. If you work for the NHS, you may not be able to prove this, but I would advise you to join probably the Royal College of Nursing or the Unison. You join whatever body that you feel is a union body that's going to provide you professional indemnity. Now, most employers provide this cover for employees, but as an overseas nurse, if you're able to afford it, I would advise that you get one for yourself just so you can have your own extra cover in case something goes wrong. Especially if you're an agency nurse or a nurse who does agency shifts outside of your normal place of practice, you should have an indemnity insurance that's going to cover you, because wherever you're going to do your agency work, you're not going to cover you, and your manager or your NHS trust indemnity is not covering you, so you should have one for yourself. You should confirm with your employer that they have indemnity insurance for you. If you work with the NHS, normally this is usually done, but if you work in a private setting or a care home, confirm with your managers and your care managers if they have professional indemnity insurance for you. If they do not have this in place for you as a nurse, please do get one for yourself. So if you work for the NHS already has a professional indemnity insurance for you. That is, the NHS insures its employees for work carried out on its behalf. So if you're working for the NHS insures you, and this means you'll be covered if a claim is made against you in an NHS role. So if you're working in an NHS role, the NHS is going to fight for you. Understand? Vicarious liability. That's what the NHS does. The NHS fights for you. But if you're working in a care home or a private setting, please confirm with your managers if they have this professional indemnity insurance for you. If they do not, please get one for yourself. I've mentioned Unison, I've mentioned Royal College of Nursing. There are many other unions out there you can join to get this indemnity insurance. And lastly, on the revalidation process is a confirmation. Now, the confirmation is for you to let your conformer, who should be a registered nurse, your manager or a senior person in a role, or a fellow registered nurse, to confirm that the things that you have declared in your revalidation applications are true. So your conformer is somebody who goes through your documents and ensures that everything that you have said, you have done, and you've documented in your application for revalidation is correct. The person signs and writes their NMC PIN, role, email address in your NMC validation application. And your conformer, before signing this, has to confirm that you actually have demonstrated that you met the requirements for revalidation. So as usual, your conformer is going to give their identification to the NMC, their NMC PIN, email address, postcode, professional address, and all of that. So basically, whoever is going to be your conformer, you have to present to them your certificate of continuous professional development, certificate of participatory learning, your reflective account, how you reflected it, whom you reflected with, confirm everything and your feedbacks, and also confirm by way of your employee roster your hours of work. So the person is going to go through your email, your employee rostering for the year, and ensure that you have worked up to 450 hours or 900 hours as the case may be before confirming your application. And it's usually advised that you have a one-on-one discussion with your conformer before you sign. So it could be your manager, it could be anyone, but you should have a one-on-one discussion. And during this period of this whole this thing, you can actually do it virtually, but have those documents in hand, present it to the person sees it and is happy, signs and vets it with their signature, documentation, email address, postcode, and everything, and every identifier for the NMC. Now, the NMC has said that your conformer must not be a registered nurse. That is to say, if you're an agency nurse working outside and you don't have a manager, it could be your management or it could be your agency, okay? As far as the person is able to see proof of the things that you're submitting to the NMC, the person can be your conformer. Also, it must not be the same person you had a reflexive discussion with, okay? The NMC has made it so flexible for you. As far as you had a reflexive discussion, however, it just makes it easier. If you reflect with somebody, you just use the person as a conformer, because the person was there to listen to you and can easily confirm that you have done this thing. So it's basically up to you and what situation you find yourself. Okay, if you work in the NHS, your care home, or a private setting, revalidation should be a straightforward process for you. And documentation of all your mandatory learning, statutory learning on your ESR should also help you and should also count towards your CPDs. You can also have other courses done by Academy or that is provided by NHS England that you can use towards your CPD. There are many courses provided by the Royal College of Nurses. You can also go there and pick up some free CPD courses, 2 points. Before you know it, you make enough points for the 35 learnings CPD points. And remember, 20 of these should be participatory. There is a conformer tool on the website that you should download also that will help you to help your conformer to fill the appropriate information needed by the NMC. So basically everything you need is on the NMC website. Just go on there, but I've mentioned the things that you should have for your revalidation: your practice hours, your CPD learning, reflective accounts, reflective discussions, and feedback. And remember that everything you do has to be in relation with your code and your practice. The whole essence of revalidation is to ensure that you're still working and practicing in terms with what the NMC has written in the code, and that you're upholding the code. And if by any chance you have deviated from this code, for you to trace your step back and ensure you're practicing appropriately and effectively and safely. And once you've gathered all your documents, all you need to do is to submit it online into your NMC online before that expiry date of revalidation, which has been given and been communicated to you by the NMC. Ensure you check which day your revalidation falls in, so you do not forget or you get lagged behind by revalidation. If you do not submit your valid revalidation application, you will be taken off the register and you are not expected to practice when you're not validated. Now, coming back into the register after you've missed your revalidation deadline is a long process, and I'm sure you do not want to go through all that. So ensure you know the date you're going to be revalidating and begin now to gather the documents you need for your revalidation. And I wish you all the best in your revalidation and your practice. Ensure you practice safely according to the code, and God bless you. If you do have any question you want to ask, I'll do my best to answer. Thank you for watching. I love you all as always.